Greetings and welcome. Thank you very much for joining us again on This Is My Health. On this season, we are looking at issues of HIV and AIDS. And there are so many things that come to mind when somebody is talking about HIV and AIDS. Today, we'll actually want to unpack one of those that affects especially those who are affected and not necessarily infected. The issue of looking after somebody who is debilitating, suffering from HIV and AIDS. I am sitting at our cafe and I'm waiting to meet now with one of our care workers. This time I don't have a nurse, I don't have a doctor. I have a nurse who is coming in to join us. Hello, sir.
Hello, Doc.
It's good to meet a male nurse. You know, people will say nurse, they expect a lady. Please come in and have a seat.
Thank you very much.
Thank you. Welcome at this cafe. I like to come to this cafe and discuss some issues.
Okay.
What would you like to have?
I would like to have nuts and maybe a few biscuits. That would be for me.
Oh, okay. May I have you please introduce yourself? I've only told them I'm bringing a nurse, but I don't know who the nurse is.
Okay, wonderful. Thank you, Doc. My name is Aubagwele Solami. I'm a nurse. I've been practicing for the past 18 years.
Okay.
In most cases, I've been working on HIV, AIDS, and tuberculosis areas in various institutions.
Oh, okay.
Currently, I'm working as a principal registered nurse at Kanye Adventist Hospital.
And that's in Botswana, yes.
That is here in Botswana. That's the southern part of capital city, Gaborone.
Okay.
Thank you.
No, thank you very much for coming through. So let's just start talking about, you know the thing.
Yes.
What are some of the basics when you are looking after somebody who has got HIV? And of course, who's looking after yourself if you've got HIV and looking after somebody. Just take us through some of the basics that you look out for.
Maybe even before I go straight there, or even defining what hygiene is in
like
broad aspect.
I like
it's
that.
Just I have to emphasize and make it clear to everyone that hygiene is the most cost-effective method in preventing disease or in preventing spread of other diseases, communicable diseases.
Yes.
So we are talking here about what can be a golden rule in terms of avoiding the spread of disease or caring for ourselves. But just in definition, I can say hygiene is practices or processes or conditions where we prevent diseases from entering our bodies or disease-causing organisms from infecting our bodies. So in the issue of HIV/AIDS, like here in Botswana, you know, we have a high burden of.
Before you get there, because you started off with hygiene, it leaves me hanging in my head. You say, these are practices. What are some of the practices, even before you go to HIV?
Yes, like I said, it's a very good question, that one. Like I said, very cost effective.
Yes.
It's basic things that don't need a nurse or a doctor or any health professional. Hand washing.
Okay, hand washing.
Basic
you know, we just come out of the COVID and we learned a lot about hand washing.
Exactly that. That was one of the most effective methods that worked, especially for developing countries and underdeveloped countries.
What is it about hand washing that works?
You know, we have to understand that in our environment, even in the surface of our bodies, there are some disease-causing organisms, so I can say bugs or germs. So our hands are the most effective parts of our bodies. So they happen to touch surfaces and also in areas where they could be those germs and organisms, then they are easily transferred to our bodies. Because I can tell you one thing, just in 1 hour, it's either you touch or you almost touch your face 23 times, just in an hour. That's how effective hands transmit germs from surfaces or from our environment to our body.
So maybe I've touched the hands, then I touch the eyes,
I touch the eyes, or
hands,
the nose,
I touch
or the mouth.
nose, and with every time I do that,
I
move a bag from one place
to another. Okay. So that is why I say hygiene, because one of the key principles of it is hand washing. So if we could wash our hands frequently, researchers will tell you we can prevent up to 1 million deaths annually.
Wow, that's
so this is very, very effective method of preventing disease
And
transmission.
then the next one.
Then the other next one is just cleaning our environment, just with soap and water, ordinary household water and household
Environment,
soap.
you mean what?
The tables, or especially areas that we touch, doors, surfaces, plates, utensils we use, things that we share with other people. It can be at home, it can be at work, it can be in the community, the side rails, the lift knobs, all those areas. If we could be cleaning them just with soap and water, we could also
when you say that, it sounds
so
simple. And sometimes medicine sounds so simple that people, when they come to a clinic and you tell them about bathing and cleaning stuff, it's almost as if you have not treated them.
And it's like you've just discharged them and you don't know what they're doing.
But what we are hearing you say is that the power is actually in our hands.
Yes.
And you don't have to go to the hospital.
That is what we call community participation in individual health. So that is the role that each one of us should play in ensuring that we don't acquire some of these conditions, which can cause very serious and detrimental conditions, especially to our, like you said, HIV positive patients, because their immunity is weakened. When they get some of these bugs and germs, they easily progress into diseases. Children under 5 years, they usually have problems with some of these bugs that are almost everywhere in our environment, just because we take them from surfaces or from other areas into our bodies. And our elderly people, because also their immunity weakens as they progress with age. Yes.
Okay, so then you are going back to HIV when you are looking after an HIV patient now.
Yes. When you are looking after an HIV patient, what we should understand is that, especially those who are chronically ill and at home, now we are talking maybe immunosuppression, that now their immune system is weak. So this is where we have to make sure that as we care for these people, our environment is hygienic. It's clean, basic hygienic. No special chemical, no special detergents to use. Just soap and water to clean the environment, sweeping the place, and making sure that there's fresh air, there's adequate sunlight, because some of these bugs, they just die out of exposure to sunlight.
So if you keep the room closed because the person doesn't like light, it's not very good for them.
It's not very good for them, because now you are like creating a breeding environment for some of these bugs. So you need to have fresh air, you need to have enough ventilation, also a bit of sunlight also.
What about this situation that patients are usually cold and they like to be in the blanket and the light? Should we not, is it wrong for people to take the patients outside? Should we keep them covered and wrapped up all the time?
In fact, it's good not just for their physical health, even for their mental health. That they should also see the environment outside, interact with the environment, be on the sun, receive the nutrients, be able to socialize, because when somebody is just closed inside and their eyes can only see the ceiling for a very long time, it's somehow putting pressure on their mental health.
In many places, I usually find that there is a sick room where the sick person is supposed to be. What do you say to that? Because I'm trying to balance taking the person out to see that and the phenomenon where we have a sick room and then the rest of us are somewhere. And I'm talking about a chronic patient. How does that, how do you balance that?
Yes. In fact, when the patient is just affected by HIV, and let me say, and additionally a cancer, then there is no risk of easy cross-human infection of the two conditions that the patients have. So there is no need for isolation in that case. But in case where now the patient is suffering from a highly communicable disease, let's say TB, we work a lot with TB, and these days we have other TBs like multi-drug resistant TB. So that is where it's very strict to have the patient in isolation. But when the patient is suffering from HIV and other diseases that are not easily communicable, they should be part of the family. Of course, they can have their room, but they should be part of the family activities so that they also interact and they also try to be part of that social care and social engagement, which is also very critical and very important for their health as people who are chronically ill.
Yes. You know, in HIV, we often talk about stigma and discrimination. Although that's not the topic for today, is it a discrimination item if the cup that was being used by an HIV person should be kept separate, or a patient for that matter, can you talk about the hygiene of utensils when you have got a chronic patient at home and you are trying not to be discriminatory? How do you balance that?
Yeah, the issue is we should first, usually what happens in our hospital, when we discharge patients like for home-based care, we do what we call family counseling. We explain the condition that the patient is suffering from, of course, with their consent to the family members, and how they should care for the patient. We are very strict with diseases like TB, and we usually make sure that we support the family to make sure that they adhere to the principles of caring for somebody with a highly communicable disease.
So can you mention one of those things?
Yes, it's like to have their own separate room or own separate space, and also to explain to them that if they are helping them with anything, they should make sure that the windows are open and they don't spend a lot of time with them inside their room. But that is in very rare instances, because usually if it's just ordinary TB, after a few weeks of treatment, the patient have now reversed the infectious state of their condition and they're able to interact with the family. But in other conditions where it's just HIV and maybe a Kaposi or a cancer, we also educate them that there's no how you can get a cancer from this person. There's no how you can get HIV from this person through sharing a bathtub, using the same bathtub that they are using, the same toilet, the same cutlery, the same utensils in the house. So they should be part of the family and be incorporated into the family. So I think the discrimination usually comes out of pure ignorance. People are just afraid that they may contract. But if you have clearly counseled and explained, usually the families do accept it.
So we're going to go for a short break, and then we'll be back to continue where we are right now.
Okay.
Please don't go away. We'll be right back. Welcome back. If you're only just joining us, I'm at a cafe meeting with senior nurse Aubakwe, who is currently working at Kanye Adventist Hospital in Botswana. The topic of discussion today is hygiene, and of particular interest are the hygienic principles and practices for home-based care. When we have got patients with chronic conditions, including patients with HIV and AIDS or other infectious diseases, how do we look after them? How do we make sure that we protect ourselves and protect them? Welcome back, sir.
Thank you, Doctor.
We've learned a lot from you in the before we went for the break. Now, I want you to talk to me a little bit about simpler issues of bathing. I find that often people wonder, should a patient be bathed? And some of the patients also wonder, should I be bathing? So what is your advice to people who are trained in this area?
Yes, it is important that we bath or encourage our patients to bath, or we help them to bath, because bathing, in fact, on its own is therapeutic. It improves blood circulation around the body, which makes sure that our nutrients and oxygen reach all aspects of the body. But what is most important is that if we bath our home-based care patients, we are helping them also to participate in their care. And also, bathing primarily is for removing debris and accumulating sweat. And some of these patients are suffering from conditions like pneumonia. They'll be having a lot of sweat. So we need to bath them so that they relax and they freshen up and they feel active and much better. Also, when we use soap, there are some organisms that may have stuck to their skin or to their body. So that is the time when we are able to remove such. Consequently, avoiding them being infected with some of those bugs.
Yes. And then in the hospitals, I not normally see that you change bedding every day. Now, what is your advice for somebody who's maybe a chronic patient or a home-based care patient? Because they are not trained and all they have is somebody sick at home. What is your advice in terms of the care for the linen?
Yes, in the hospital, the daily change is for prevention of further infection, spread, and also the conditions usually do allow because of the facilities that we have to change. But we do encourage the caregivers that they frequently change the linen. They wash, they use others for a day, for two, to avoid accumulation of infections or bugs around
Is there, just at home, you may not be able to do it every day. Knowing home environment, what is the minimum time that somebody's advised in terms of changing of the linen and washing that?
It varies from area to area and how capable the family is to sustain changing linen. But within in 1 week, especially small things like sheets, every 2-3 days you can change. But the big linen every week, make sure that if you use the other, then the other one is out there.
It's outside drying.
Or washed, and so that it can be
probably in the sun, I suppose.
Yes, it just depending on the home setup, because sometimes even just washing those, you find that the carer is maybe an old lady, an old woman, and or an old man caring for their son, and washing and fetching water from elsewhere is difficult. But usually, sometimes we have home-based care volunteers who assist in such instances, because linen also can harbor a lot of organisms. Hence, now going back, now the patient may be now suffering from additional conditions that come from this. So hygiene is very critical in that area, that we need to make sure that we wash the linen. We also make sure that we bath, or we have to bath our patients, and we also keep the environment, their room area very clean, well ventilated with adequate sunlight.
I like that you said there can be some volunteers. I think some of the things that we should be talking about in our communities, you see, this is why when in a community we know somebody has got somebody who is suffering, the most compassionate thing that we can do is those of us who are able-bodied could be going to help. I'm glad that you are putting out the principles themselves, because just because the caregiver is not able to do something does not mean it stops being important. I think I like that you are saying if there are some volunteers and some people, and these days we have a lot of young people. I think a lot of those young people could actually be going in there to become useful. These are the areas where people can be useful to be helping others. Now, let's look at, you talked through the issues of the cleaning of the house and the cleaning of the environment and everything. Now, let's talk about the issue of the mental health or the mental issues of somebody who is caring for a chronic patient. Remember, I said home-based care, and it's a very difficult thing, I believe.
It's a very tough situation, especially for the caregivers who will have sometimes to abandon sometimes their work to care for a very sick family member. We've had instances where students had to drop out of school to care for their parents. We had parents who had to leave their cattle posts and their farms to come and care for their children. So it's a situation where now we need the intervention of psychosocial specialists or professionals who should come talk to these families, encourage them, also link them with other organizations that can help assist them from day to day. And it also needs the intervention of a religious organization to come and also, be with these people.
So you're taking support groups of different types.
Support groups of different types, and because you find that it's not only psychosocial, it goes to even being economic. Because people have abandoned their farms and left.
And I think the one that we just talked about also, the physical aspect of it, because that's part of the support groups.
Yes, you need people who are active to assist the old lady who is caring for their son, because sometimes they can't lift them, they need to be assisted, to be ferried to the clinic for their reviews. So that is, there is an area that needs to be
Addressed
entered,
in that
yes,
way,
and
yes.
entered and addressed, where we need to support this. They are doing their best. It's very encouraging to see how people love their family members, that they sacrifice a lot.
So much
but
for them.
yes, but it ends up draining them
Yes.
mentally, and they need this support, they need this encouragement. They also need physical support and material support, so that at least when they're caring, they don't run short of food, they don't run short of soap for washing their clothes and their linen and the like.
You know, you remind me of one time I went for another workshop where we were talking about caring for the caregiver. It was very deep to realize that, you know, the caregiver has got other issues. But before we go too far away from the hygiene issues, I would like us to talk a bit about hygiene in the kitchen. Is there any advice or anything that you would like to talk to our viewers about the hygienic issues of the kitchen? Because some of the questions I sometimes hear is like, should we wash the cutlery with the same, the dishes with the same? And I remember during COVID, there was even one advice that came out to say, put them aside so that the dishes and things for somebody who has COVID should not mix with the rest of the family, because there was understanding that the bug could go. What do you have to say now in terms of HIV, AIDS, and others? What do you think?
Yes, it varies from like the condition to condition, but in terms of HIV and its related conditions, other than tuberculosis, but for cancers and other chronic conditions that come with HIV, it's okay to wash the dishes together, or not to segregate the utensils that the sick person is using with others. But what we have to avoid is to make sure that we don't do a lot of mix-up without hygienic practices, that we end up exposing the rest of the family or our patients. But with these chronic conditions, usually we shouldn't have that segregation that is clear, that no, don't touch this cup because it was used by that. As long as we make sure that we use soap, we use warm water to wash them and thoroughly, and we dry our environment is also clean.
I like what you are saying, that we should look at conditions, because there possibly are other conditions where we have to be mindful. Must the caregiver always be wearing gloves when they are looking after the patient? You know that there's that talk going around.
The caregiver don't necessarily need to be putting on gloves all the time. They're caring for the patient.
What about when they are bathing the patient? Should they wear them?
Yeah, they should be, especially where there's a possibility of
open
sores, breakage of skin continuity.
So it's a good idea to have the gloves.
Yes, and now you are also there affecting a wide surface area of the body. And in some of the areas you may not see that there is a small cut here. So it is important to use the gloves. But if you are feeding the patient, you're just using the spoon, it's not mandatory to be putting on gloves.
Does the patient feel bad if you are feeding them wearing gloves or what?
Even if myself, I'm not sick and you are saving me, or you are assisting me with gloves, but there's no close or wide surface area contact that is there. It's more of
stigmatizing.
Yes, and I think it will make the patient very uncomfortable, and they may not enjoy it.
I can see that there's balance there. Our time is gone out, but before you go, there's one last thing I would like you just to comment on in half a second. Disposal of nappies and the like, because some of the old patients, we also have to use napkins and the like. What would you suggest or advise on that?
Yeah, any human excrete or any products that come from the human body, they are biohazard material. So families and caregivers need to exercise a lot of precaution when handling it. They should make sure that it's put in biohazard material, containing materials like red plastics, clearly labeled, and they are put into containers that cannot be washed away or taken away to contaminate the entire environment. So it is important to know that these are biohazard materials, and once they are exposed to the environment, they can bring us some public health issues. So it is important for us to be very cautious in that regard.
Yeah, our time is up, but thank you very much. We've learned a lot from you, sir.
Thank you very much.
There you have it. It was very brief, you would think, because we seem to be talking about everyday issues. But the reality is any disease that you have that is infectious could have actually been prevented. And as we have learned, the first deal with prevention is just simple cleanliness. We often talk about drugs, vaccines, and all sorts of very, very difficult and expensive things, maybe ignoring the very simple and basic things that are close to us. Washing our hands, bathing our bodies every day, changing the linen, cleaning the environment simply with soap and water, and making sure that all these bugs that live with us don't find a way to get into our bodies and contaminate us. Now, when we are having somebody who is sick at home, their immunity is also even lower. That's the point where we have to be even more so careful about our hygiene, careful about how we behave around the person. Being careful doesn't mean that we should not keep them clean. Let's help our patients be bathed daily. Let's help them to bath themselves. And when we are bathing them, remember to wash their mouth also. Every part of the body, especially the hidden parts of the body, they are the ones that need washing even more. Let's look after ourselves, because being clean, just simple old water, is one of those things that can really, really improve our health. Let's not discriminate our patients. I hope that you have learned something today, and I hope that you will care for your patients with love. Lastly, remember that on the Adventist AIDS International Ministry, we have got a program that helps you to start support groups. We would like you to try in your community to have support groups, because as we have heard, support groups are important for the health of the caregiver and also for the health of the one who is sick. Until next time, keep watching, keep praying for those who are sick, and loving them. You are watching this.